Hello, everybody, and welcome to another production of North of Ordinary, a series where we dive into the stories behind extraordinary people, businesses, founders, freelancers, techies and creatives in the Hull and East Yorkshire region. We find out their stories, find out what they're doing, why they're doing it, and the problems that they're solving in this brilliant region. Today, I'm joined by Rob Lewis. Now, Rob is the R&D specialist who has worked for many global healthcare companies and is the CEO and founder of FLX Health and a long-time member of C4DI. And a great person to have around, Rob.
Thanks, Tina. Thanks.
And today we're talking about musculoskeletal health.
Well done.
Yes, it's hard to get out, isn't it? And how about adding life to your years is better than adding years to your life. Yes. Rob, I'm in, because I don't want to be 100 years old and not enjoying life. No. So what do I need to do now, as obviously somebody in their mid-30s, what do I need to be doing now, Rob, to make my life later on more quality for me?
Okay, so what we're talking about here is our healthcare system has basically extended people's lives, so we have greater life expectancy than ever before. It's actually gone down since the COVID pandemic for a number of reasons that we don't need to get into just yet, but it's still pretty long in historical terms. So healthcare, pharmaceuticals have all, our doctors and GPs, hospitals have extended our lives, so they've added years to our life. But what happens very often is those extra years are added, live with an impaired quality of life because we have lots of comorbidities. Comorbidities means lots of other illnesses, things going wrong with us. So type 2 diabetes, heart disease, dementia, Alzheimer's, etc. So as a healthcare system, we've been quite successful in extending people's lives. But what we haven't really focused on, particularly in this country, is improving the quality of life. So we need to move from adding years to life to adding life to those years, because what you want, as you just verbalised very effectively, Tina, is we want to live for a long time, but we want to live that extra life, the extra decades that we get after retirement potentially. We want to have a high quality of life, which means we can have great cognitive function, we can function, do all the things we want to do, be physically active, all of those kind of things.
So what do we need to be doing, Rob?
Well, there's a lot of things you need to do. We all know what we shouldn't be doing.
Yes.
We shouldn't be drinking. We shouldn't we shouldn't be smoking. All that's a dying habit. We shouldn't be vaping, kids. And having a good diet, etc. But fundamentally, the most important thing to have a good quality of life when you're older is to retain physical activity.
And that's any kind of activity.
Yeah,
it could just be literally. Yeah. Just walking?
Yeah, absolutely. So, that whole 10,000 steps a day thing when Fitbit came out was, kind of criticised in some respects because they chose an arbitrary number of 10,000 steps and said you should be doing 10,000 steps a day. It's kind of missing the point, actually, because what it is doing is holding people to account and quantifying their exercise. So they're effectively gamifying exercise. So, in the early years of Fitbit, it was a very primitive device that just had lights on. And when you got the 4 bars, you'd done 10,000 steps. But that's encouraging people to be physically active. So walk to work, take the stairs, not the escalator, those kind of things. So when we're talking about physical activity, we're not talking about doing a marathon or, cycling for 100 miles or even doing the park run. We're just talking about doing a bit more activity every day. And that has a really beneficial cumulative effect on your overall health.
And even at your desk at work, you could.
You could.
Get up and about, and
I know for a fact you do that every day because you're all over the place all of the time.
That's why I wear trainers every day.
Very good, very good. Yeah, so obviously, if you sat at your desk all day, it's an incredibly sedentary occupation, and you're probably moving your right hand to move the mouse if you're right-handed, and that's about as much exercise as you can do. You could have a standing desk that would give you a lot more musculoskeletal benefit than sitting down all day, but just taking regular breaks. And obviously today, with the trend of working from home, you have a really large section of the workforce who used to go into the office and is now sat at home. Potentially you wouldn't leave the house for 5 days. You might just do things at the weekend, and that's really toxic from a a musculoskeletal point of view, also from a mental health point of view. I know, like in a normal working environment, that in my corporate life, you're working in a large building on a large site and you go from meeting to meeting. You actually do quite a lot of steps going from meeting to meeting, even though you spend most of the day sat down between meetings, but at least you're moving around. Obviously, when you're working at home, you're not doing that. Presumably go to the toilet a few times a day, maybe make your lunch, hang out in the washing, but that's not going to be very many steps.
And people working from home, a lot of them do have their home office and the desks and everything set up there. But a lot of them started off just on the dining room table, didn't they? Or laptop on the settee. And that can't have been very good for the posture and such like as well.
Well, there's two aspects to that, really. Firstly, if we go to a workplace which is not our house, we have the ritual of going to work, which involves leaving your bedroom, going out the front door, walking to your car, or even walking to the bus stop, or even walking to work. So we're taking that out of the equation. We're taking out, unless you live in a mansion and you've got to walk.
Like I do,
obviously,
Rob,
Tina,
yes.
I thought I'd include you in this. Then you're not going to be walking around a lot in the environment that you're working in. And then the second compounding factor, as you mentioned, is if your workspace is not optimized. So I don't have an office at home. I just work from my kitchen table. That's why I'm using C4DI, because I don't really like working at home. You're working in a non-optimized workspace. If you work in a large organization, you'd have an assessment of your workstation every year. You're obviously not doing that. You potentially have to invest quite a lot of money in having a well set up workspace. A lot of people will not have the room to have even a kitchen. You could be in a studio flat, and then that's taking away all the opportunity for physical activity. Yeah. So we need to build it in other ways.
And I suppose if you're at work, say, and you've got bad posture and you don't move as much, you're obviously more likely to have sick days, because it impacts on maybe bad back, bad hips, bad knees, or whatever like that, and that must.
So musculoskeletal disease is either the number one or number two leading cause for absenteeism from work. So if people are off work, it's for one or two reasons. Generally speaking, it's either you have musculoskeletal health issues, or you have mental health, anxiety, stress. And depending on what sector you work in, musculoskeletal health will be number one. The Health and Safety Executive in the UK has identified 5 sectors where musculoskeletal disease is unacceptably high. And that's, I'm testing myself here.
Come on.
It's construction, heavy industry, farming, fisheries and agriculture, transport and logistics, and one other. Come on, Rob, you've got this. There is another one, believe me.
Yes, it'll come
anyway,
to you, Rob.
The point is, all of these occupations, those tend to have high levels because they're very manual. So obviously, if you're working in construction, then you're doing something very manual. If you're in logistics, you're driving around in a lorry, you're moving boxes. There are clear musculoskeletal risks around that. But equally, sedentary jobs have a risk for a different reason, where you just sat around doing not a lot each day. What's really interesting about manual work, I don't know how. I'm at risk of exposing myself as a very soft white collar worker here today, but we have lots of trees around our house, and every autumn I have to clean up a load of leaves, and every single time I do that, I get blisters on my hand because I've just got such soft, beautiful hands.
Oh, let's
but also, like, my back really hurts. So you kind of like spend half the day clearing out the leaves and think, God, I've given myself blisters and a bad back. What do these poor guys who literally do this 8 hours a day for their entire life do? And what they do is they adapt. So they adapt, their biomechanics changes to accommodate their work. And what that means is they start to move in a way which is not a natural way. And that causes lots of musculoskeletal problems. So, these people doing these occupations, they effectively adapt, shifting boxes, whatever it is they do. And, that basically forces them to move in a way which is not natural. And that causes lots of knock-on musculoskeletal problems. Because as a species, we're evolved to move in a certain way. And fundamentally, modern life has degraded that movement, because since the Industrial Revolution, we're a species of millions of years of age that's evolved over that period of time, and we're evolved to move in a certain way. But because of the Industrial Revolution, we now live a very easy life. So we should be out hunting and gathering and defending our family from being eaten by the neighbours and whatever animals exist.
But that's what I was going to say as well. Is it just a problem in more of the developed world and not in the underdeveloped world? If they're doing more I don't know, like hunter-gathering thing, you know, like, it's,
Well, I think
you know, if you like in like a tribe in South America kind of thing, would they still suffer from musculoskeletal
I'm not
disease?
100% sure about the answer, but
Rob, why not?
I know I'm terrible. I know why have you got me on this podcast? The problem is really that people, you know, were through evolutionary terms, we just have a really easy life.
Yeah.
You know, even if you play sport and you reassure yourself that I cycle to work, I go to the gym, I play squash, whatever. That's all well and good. It's good for your cardiovascular system. It's actually often very bad for your musculoskeletal system because most sports and pastimes, like going to the gym, involve repetitive movements. So golfer's elbow, tennis elbow, you know, bad knees from running, etc. So we're really doing things that we're not designed to do. And what you said, you know, it is probably a plague of Western societies where we have a high degree of affluence. We eat too much, an abundance of calories, have a very easy lifestyle, which is all very negative. But there's some work done. There's I think they're called blue zones or something in the world. So there are parts of the world where there is unexpectedly high longevity. So Japan's one reason, the Mediterranean's another one. And they've done studies in these areas and looked at what are the common reasons for these people having such high longevity. And it's, you know, like in Japan, for example, older people are revered. So they live, grandparents live with children, and that's great from a longevity point of view. But one of the things they also found is like people who don't have furniture sit on the floor. So if you sit on the floor, we could try it now, but we'd knock out the microphone, so we don't want to embarrass ourselves on the camera. But it's actually quite hard to get down and get back up again.
Getting back up.
But if you do that for your entire life because you don't have chairs and that's what you do, then actually your musculoskeletal system's in great shape. And like in Japan, for example, I've been fortunate enough to visit Japan on a number of occasions through work. And you go out for a meal and you sat at a table as low as that yellow table there, and you sat on the floor. It's actually quite painful. Sit cross-legged for like a 3-hour meal.
Please let this meal come to an end, please.
But these guys are adapted to do that, and that's one of the things that they have around longevity because they're doing these kind of things. So that's just one aspect of musculoskeletal disease. So it's really important that we basically keep our, you know, there's a complex relationship that exists between our muscles, joints, connective tissues, nerves. I think I've probably missed out bones. Yeah, they're quite important, aren't they? And that's a very complex relationship. All these things work together, and if something goes wrong somewhere, it causes problems elsewhere, and we need to basically protect that overall system.
So we need to improve our movement.
Mm-hmm.
But is anything like, because I take like calcium tablets to keep my bones, what I think would keep my bones strong. Does it?
Well,
is it worth doing?
Clearly, if you're a woman, which you are, Tina,
yes.
I know how old you are as well, roughly. So I'm
mid-30s.
Yeah, exactly. So in the future, you may be subject to the risk of osteoporosis as a woman.
Yes.
So you'd want to take calcium supplements for that potentially. That's going to benefit that. You know, ideally, you would get all the nutrients and minerals from your diet, but you know, depending on how bad your diet is. I've observed you eating. I think you've got a reasonable diet, but you know, so well done, well done. Yeah, so you know, you can supplement to help these things, but really, there's nothing that substitutes just doing a bit of physical activity. It has like a multitude of benefits to your health, primarily because it gets your heart pumping. The heart pumps blood around the body. Blood carries oxygen, and that makes you think more clearly. And it just, you know, the energy that the blood brings with oxygen to the cells basically causes regrowth of cells, reduces insulin sensitivity, improves your nervous function, etc., which is why physical activity is so beneficial for every aspect of your health, not just your musculoskeletal system.
So if I had a job that had, I did lots of walking, like a postman or something like a postwoman, something like that, how do their stats compare with somebody who sits at a desk all day?
Yeah, I used to live on Princess Avenue, a bit of a whole reference there for the people listening, but you know, if you go to the pubs on Princess Avenue at 12 o'clock, all the posters are in there, so that's outweighing some of the benefits of their job. But but fundamentally, if your job involves walking, I know, let's say 10 kilometres a day, then you know that's going to be really good for your musculoskeletal system, and you've got that's built into your health programming, which is great.
Excellent.
You know, there was a study done in the 1950s where they looked at mortality among different groups of workers, and the post office looked at compared people who worked in sedentary jobs, like sitting behind a post office counter, and compared that to people who were the postmen. And what they were showed in that study is that people who had sedentary jobs were dying of heart attacks, and people who were the postmen had fewer cardiovascular morbidities. So, very clear evidence that those kind of active jobs, when you compare to people in the same organisation, having much better health or cardiovascular health outcomes.
And if I'm carrying a few extra pounds, I know I am, does that affect my musculoskeletal?
Yeah. So fundamentally, if you're vastly overweight, it's going to put a large strain on your joints. And
What are you trying to say, Rob?
I'm not saying anything, and I'm in no position to cast aspersions. If you had OA of the knee, for example, then a very sensible thing to do would be to look at your BMI and reduce your weight. But it's not all about that by any stretch of the imagination. And actually, if we're thinking about our overall mortality, we tend to judge people on how fat they are. It's something you can't hide. And if you're fat, people think you're fat and lazy and unhealthy. But actually, people have done studies where they've compared people of different levels of weight. So people of normal weight, people who are overweight, and people who are obese, and then categorise them as to whether they're fit or unfit. And what they showed is if you're fit, there is no increase in your all-cause mortality. So in other words, what you're going to die of, or that your risk of dying, if you're normal weight, overweight, or obese, as long as you're fit. If you're fit, you mitigate that risk. And what they also compared those categories of normal weight, overweight, and obese with people who are unfit. And what they showed is your relative risk if you're obese is 3 times higher. So you're 3 times more likely to die if you're obese and unfit. But if you're just fit, you can remove that risk. And it's really an artifact of BMI, because BMI is not a satisfactory measurement because we apply it to men and women. Men have different frames. They're usually more muscular, and their muscles weigh a lot. So you can be super fit and have a high BMI. So we shouldn't be obsessing about a weight line. And I would use, as a rugby player, use the example of rugby players.
Because they're built like that, aren't they?
Yeah,
you would think, one of those units coming towards you, kind
exactly.
of thing,
And if you look at the England front row,
what's their average weight? Is it like
I don't know what the
20 stone or something each?
So, not wanting to point names, and Will Stewart's the prop, Jamie George is the hooker, and Ellis Genge's the other prop. They've all got BMIs north of 30. And Will Stewart's is 37 or something like that.
And what's the ideal BMI?
It's about 25.
Why?
So these guys would be classed as being clinically obese, but obviously they're elite athletes at the peak of fitness and have a very low risk of cardiovascular events. So just an example of why it's fitness, not fatness, that matters. I mean, obviously, being fat does increase your risk of lots of diseases, but fundamentally you need to address your fitness. Your cardiorespiratory fitness is the most important thing.
And how do you measure that? You can't measure that yourself, can you?
Well, you can if you've got a Fitbit or any. You could download Strava for free, and that gives you a measure of how fit you are. The more tech you use, the better. There's a measure called VO2, which is basically your lung capacity, and that's a really good indicator of fitness. But your resting heart rate is a really good indicator of fitness. So if you have a low resting heart rate, then generally that means you're, unless you've got a really bad heart disease, it means you've got great fitness. So just your heart rate's a really good measure. Blood pressure would be even better. That's the biggest risk factor for cardiovascular disease. So ideally, you should know your blood pressure, especially if you're a man. Women are at low risk, so I don't think you need to worry. I think you probably don't need to worry anyway. But most, cardiovascular disease kills people, relatively young ages, like 40, 50, especially among men. So it's actually quite important to know if you've got high blood pressure.
And you can get the monitors at home, can't you, that you can do yourself, kind of thing?
Yeah, so you can obviously you can probably buy one on Amazon for £10, I would imagine. Some of the smartwatches already measure blood pressure. Apple Watch is rumoured to be able to add that functionality soon. But there are apps that can measure your blood pressure from your forward-facing camera on your phone, which is really interesting. And what they're using is the LiDAR sensor on your camera to measure blood flow in your face, and they've got an algorithm that calculates your blood pressure from that.
Even behind all this makeup, they can judge that.
I'm not so sure about that. I'm not wearing any makeup, you may have noticed, but I don't know. We'll maybe try it later.
Yes. But it's amazing the tech that you can use nowadays to help you.
Yeah. Yes.
Improve.
Yeah. So we live in a world where if even just weighing yourself is a really important. No,
I don't do that.
Neither do I. Scale's not big enough. No.
No.
But the technology is really important because it allows you to track and trend things. So like if you want to lose weight, the first thing you should do is weigh yourself, and you might go, crap, I didn't know I weighed that much money. It kind of spurs you into action. Then you change your lifestyle, maybe do a bit more exercise, or even reduce your calories, or ideally birth, and then a week later you've lost 2-3 pounds, and that's like a sort of pat on the back to encourage you to carry on doing it. So this like gamification of health is really interesting, and one of the key ways we can help people move into a preventative health state by if we can track something that's an important risk factor for you, and we can show that by making a small modification we can improve that risk factor, then that's effectively giving you like a reward cycle.
And do you think we're living longer at the moment? So do you know what the average age is like for a man and a woman now compared to what it was? Kind of thing?
But I think the Bible, was it like, is it 70?
Yes.
Some X score years and 10? I don't know. I think it's 70. So, that's classic sort of, let's say 1970s, 60s kind of life expectancy. Now, today it's more like mid-80s, and women live slightly longer than men.
But then we're still working up into our 60s, and it'll be 70s by the time my pension comes around, kind of thing.
Well, we're trying to stay off politics, but
sorry.
There are lots of reasons for that, isn't there? But you haven't. The prognosis for pension age is it 67 now? Could easily go up in the next couple of years, and then you're into your 70s, and then how many years of additional life are you going to have where you're not working? And what kind of job are you going to do when you're 70? So
exactly. But if you're like a firefighter or anything like that, surely you can't sustain that level of job intensity in your 67 as you were in your 20s. You can't be up and down ladders and your noses.
Yeah. It's not even just the physical competency; it's people's cognitive competency as well. And people get tired.
Oh yes.
We're all having that, can't we? But
so in like maybe 20 or 30 years' time, or maybe 50 years' time, are we still going to be putting another 10, 15 years on to our living age, do you think?
Who knows? Who knows what would happen in terms of advances in medicine, but let's hope that whatever does happen in terms of longevity, that's backed up by the things that are going to allow us to live that extra life with a high quality of life, because that's really what we need to be talking about.
Are we just clogging up our nursing homes with more and more people, older and older?
Yes, pretty depressing, isn't it?
God, it is. Yeah. I'm so glad we had this conversation, Rob, because I'm like...
So you are only 30, so you don't have to...
Well, exactly. I've got plenty of time to think about it yet, haven't I?
Yeah, so don't worry.
Oh, so I'm just thinking, what else do I need to be doing now?
Yeah, I genuinely think that the key thing to do is just more physical activity.
Right.
I mean, I know you've got a dog, you do a lot of walking.
She don't walk very fast.
Well, you maybe get another dog.
I've got to get rid of her and get another one instead.
But yeah, I think to me, that's your number one insurance factor. And it's going to have lots of beneficial effects. You will lose weight as well, which, I already said fatness isn't important, but a good side effect of physical activity is you consume calories, which mean, it keeps your waistline in check. So just be physically active. That's the best advice I think you can have.
But then I think, I've been for a run this morning.
Well done.
I can't have that cake from Nibble. I kind of like...
No, well, you're kind of offsetting those calories because depending on how far you run, you probably consume those calories. But
have you seen the size of the cake?
Well, no, I haven't actually. I'll look next time, show me. But you're doing the right thing. You're using your musculoskeletal system, looking after that, looking after your heart is going to outweigh the negatives of whatever reward you gave yourself. You should just use the reward of tracking it on Strava later and, looking at your kudos.
That's a bit boring,
doesn't taste
isn't
very good, does it?
It doesn't. That's a bit dull in comparison.
Sorry.
Excellent. Well, thank you so much, Rob.
It's a pleasure.
For speaking to us today.
Okay.
And if anybody wants any more information, how should they get in touch with you?
come down to C4DI and see me. No, you can email me. If you want to find out what we're doing at FLX Health around musculoskeletal disease, look at our website, which is flx.health, or get in touch.
Excellent. Thank you so much
Pleasure.
once again. And thank you, everybody, for listening, and look forward to having another edition of North of Ordinary soon.